Hello, hi. Selamat petang semua. Saya Dr. Vignesh, pakar obstetrik dan gynecology. Lebih kepakaran dalam maternal fetal medicine. Dan hari ini bersama kita ada seorang pakar konsultan fetal maternal specialist as well yang akan berborak dan berbincang mengenai satu topik yang banyak orang yang tidak tahu pasal topik ini, alright? Mereka tahu benda ni wujud, tetapi macam mana nak menggunakan test ni dengan lebih betul, alright? So kami dari Hospital Tengku Azizah Kuala Lumpur yang mempunyai kepakaran melihat kandungan berisiko tinggi dan juga kita juga deal dengan baby-baby yang abnormal. Alright, so I would like to introduce our speaker today, which is Dr. Buwanis, who's our consultant maternal fetal medicine, who is have a very high focus and also interest in fetal medicine especially. So Dr. Buwanis, can you introduce yourself, Dr. Buwanis?
Hi, Vignesh. Okay, thank you for the invite, and I'm very pleased to be here. And I'm actually a maternal fetal medicine consultant, and I'm currently serving in Hospital Tengku Azizah, which is a branch of HKL here in Kuala Lumpur.
Okay, so doctor, so today, of course, our scope is very wide, but we only got 30 minutes. So we will try to jawab soalan-soalan yang selalu orang tanya pasal this thing. Our topic today is apa tu NIPT? A lot of people, we go pregnant only, they say do NIPT, it's very important, must do. Mahal pun tak apa buat. So but there must be a benefit to it. So a lot of people don't know apa tu NIPT. So and how this NIPT tu can ensure that kita punya baby tu normal ke tak. Kalau my NIPT normal, does it mean my baby is normal? Or if my NIPT is tak normal, is it betul ke my baby tak normal? So there's a lot of confusion that's happening. So this discussion, kita berharap kita boleh clarify all these uncertainties so that people at the public or even those who are running offering this test can actually do a proper counseling to their patient. All right. So we'll kickstart with this seminar by I want to ask you, NIPT itu apa actually, doktor? What is NIPT? And macam mana NIPT itu boleh terbentuk atau terwujud? And why do we use this to screen people in pregnancy?
Okay, thanks, Vignesh. I think this is a very, very important topic, that everybody should be aware of. Doesn't matter whether it's the patients or is the practitioner who's going to discuss about this NIPT. Let me tell you, this whole thing about this NIPT, it all started with the effort of Down syndrome screening in pregnancy, So Down syndrome, when we talk about a genetic, our body has got components that decide how we are made up. What is the color of our eyes? What is the whether our hair is straight or curly? Whether I have a high nose, whether I have a small nose. It is all decided by genetic, and the genetic component that decide this is in our chromosome. So we have about 23 pairs of chromosome, out of it 22 is autosomes and one more is a pair of a sex chromosome. So when we talk about chromosomal abnormality, it can be in form of number abnormality and structure abnormality. Of course, number abnormality is more common, and aneuploidies are common. And out of the commonest aneuploidy, it will be Down syndrome. So when you talk about in context of Malaysia, in every 900 to 1,000 births that takes place, one child will be the syndromic child, Down syndrome child. And this Down syndrome is one of the leading cause of neurodevelopmental disability worldwide. So that triggers the concern that actually made people screen for this disease. Okay, so we can see over the years, the screening for Down syndrome has actually evolved. It started off with maternal blood screening. They had a first trimester, then they incorporated second trimester, and then followed by we had knuckle translucency. When we do a scan, we look at the fluid at the back of the fetal neck. And then we came out to NIPT. All right. So this NIPT, it is a form of screening primarily dedicated for Down syndrome. I would say that. Okay. So I can tell you that it's highly efficient. Why is it highly efficient? Because it has a very good detection rate, almost 99% detection rate for Down syndrome, with a very false positive rate, which means if it is positive, the chances being very false, it is very low, 0.0%, and it has got a very good specificity rate, 99%, which means if I
Hmm.
tell you you are low risk, the chances of your child don't have Down syndrome is also very, very low. Okay. So
Okay.
how does it work is it detects the free floating DNAs in the mother's plasma. So in your mother's blood, we take the mother's blood and we look at the DNA which is floating in the plasma. Okay. So this DNA can come from two origin, one from the mother and one from the placenta. So those that comes from the placenta, we assume that it represents the fetus. Okay. And in a pregnant mother, 2 to 20% of the floating DNAs that you can see in the plasma actually comes of a placental origin. So we utilize this free floating DNA of a placental origin, presuming that it will dictate for the fetus, and interpreting it in form of a DNA testing, and it is a screening test. Okay, all right.
So, thank you Dr. Bonis for clarifying that. So, di sini saya nak tekankan bahawa NIPT is a screening tool. Maksudnya kita hanya screen saja. Sebab utama NIPT ni diwujudkan ialah untuk screening untuk Down syndrome. Alright, it has the highest sensitivity. That means dia paling sensitif untuk detect Down syndrome and paling sensitif untuk detect Down syndrome. Tetapi kita boleh juga test untuk perkara-perkara lain ataupun masalah genetik yang lain yang kami akan terangkan kemudian. Tapi asal usul NIPT ni datang ialah untuk screen mainly for Down syndrome. Alright, so itu 2 points that from the first question that we want to highlight is number one, it is a screening tool. Okay, it is not a diagnostic tool. Maksudnya kita bukan confirm your baby ada Down syndrome. Bukan, kita hanya buat saringan sahaja. Alright, number dua, dia first diwujudkan untuk screen untuk Down syndrome. Okay, sebab as Dr. Borak cakap, kita dah evolve daripada dulu kita buat nasal bone, kita buat different type of screening, but now it's more sensitive and more specific is using this NIPT. Alright, Doktor, boleh tak NIPT ni siapa-siapa pun boleh buat? It can be offered to everybody, or is there syarat-syarat yang patient tu kena ada sebelum kita bagi tahu patient ni, okay, you need NIPT, you don't need NIPT? What is your take for that?
Okay. Sebenarnya kan NIPT ni dia tak boleh ambil macam folic acid. Once UPT dia positif, semua orang dapat NIPT. That it doesn't work. So definitely there's a syarat. We call it a pre-execute. Means there is basic requirement. Mesti ada benda assessment yang kita buat dulu sebelum kita cakap kat seorang tu, okay, you kena buat NIPT. So what is the basic assessment? So we have two things. You have dua benda yang kita kena buat. Satu adalah kita kata sebelum pre-test assessment and pre-test counselling. Okay. So pre-test assessment ni kita ada dua benda kita kena buat. Satu, we have to take a good history. Kita kena dapatkan sejarah perubatan yang bagus daripada pesakit. Number dua, ultrasound. Let me tell you. So sejarah perubatan ni is basic principle in any medical field,
Correct.
We have to take an history on the mother. One, based on her family history. Ada tak sejarah masalah genetik atau masalah kesihatan, ada masalah yang inherited dalam sejarah keluarga. And from there we can decide what is the type of inheritance that comes in, okay? And whether these people, this particular family member that has that particular problem has been investigated. Pernah disiasat ke tidak? So apa masalah genetik yang daripada siasatan yang dibuat tu? All that is important component, okay? Number two is the previous obstetric history. Means kalau ibu ni kandungan dia kandungan kedua, ketiga, anak yang sebelum ni sihat ke tidak? Pernah ada masalah juga. Kalau ada masalah, apa masalah tu? Dari segi struktur ke, dari segi neural development ke, take a good history. Okay, that is the history part. Number two, you kena buat ultrasound. So this ultrasound examination prior to NIPT is extremely important, I would say, be it in the first trimester or be it in the second trimester. Kalau seorang tu dapat datang dalam sebelum 13 minggu, and you want to offer an IPD screening, make sure you watch scan, make sure the dates are correct, okay? Because you have to date the pregnancy because before you actually do the screening. You make sure
Correct.
the baby is alive before you actually offer
Correct.
the NIPD screening. You
Correct.
decide the number of fetuses. Is it singleton? Is it twins or triplets? And at the current era, many people are trained to actually do structural anomaly screening in the first trimester and a knuckle translucency. So let me just tell you, if you see a child in the first trimester, then you can see that it's not viable anymore. You're not going to offer the screening. Or if you see a child with a very little structural anomaly, contoh macam anencephaly, also you're not going to offer an IBD screening. The same goes if the patient comes in the second trimester, lebih lewat pun. You still have to do an ultrasound scan because it will change the way whether you want to offer her a screening test or a diagnostic test. And then that
Betul.
is assessment. Then comes to the counseling. Counseling ni adalah cara kita memberitahu patient kita mengenai NIPT. Okay? So let me tell you that I think we just have to agree that NIPT has become very commercialized now. So patients pesakit kita mendapatkan NIPT without even faham sebenarnya bagaimana NIPT itu boleh membantu seseorang. Let me just give a clinical scenario. I had patients who are coming in with the clinic with NIPT into my clinic, abnormal NIPT result. And when I asked them why actually you did this result, is because the staff said, "What? You're pregnant? You haven't done an NIPT? You should do it." So it has
Sounds
become
like
very
macam kalau
commercialized. It's
pregnant
become
wajib buat itu.
social. Yeah, correct.
It's not
So
right lah.
few things that patient has to know before they actually embark on NIPT, that NIPT does not guarantee you a healthy child. This is something that everybody has to know. Okay, membuat NIPT and having a low risk NIPT does not guarantee you a healthy child. Okay, number two, NIPT is still very efficacious only for 5 chromosome, which is 21, 13, 18, X and Y. Although sekarang kita dah ada expanded usage of NIPT, we use it for rare chromosomal disorder, single gene disorder, but it's still very efficacious only for this 5 chromosome. And NIPT detects problem in terms of chromosomal abnormality in terms of number. It doesn't tell you chromosomal abnormality in terms of structures, deletions, and so on. Okay, and it is a screening test. It is not a diagnostic test. Okay,
Yes.
so even if it comes back as high risk, that doesn't mean your child is problematic. It only
Correct.
means the child most likely to have it. Dia tak bermaksud confirm bermasalah because it's not a diagnostic test. Why? Because the cells comes from the placenta. It's not the direct tissue of the fetus. Correct or not? Okay. And it does not exclude all genetic issue. It does not give you information about the baby structures. Just because you have an NIPT which is normal with you, it doesn't tell you that the baby is going to have normal heart structure. It's just because you have a normal NIPT with you, it's not going to tell you the baby does not have growth abnormalities. You understand? Okay?
Correct.
So these are
Correct.
basic things I think that we have to do. Kita kena melakukan dua benda perkara tu sebelum kita offer NIPT to our patients, and the patient need to know what they are facing for when they actually go for an NIPT screening.
Correct. So actually saya nak highlight satu perkara sebab Dr. Bonis dah bagi tahu pasal benda ni. Saya pun ada satu pengalaman di patient tu buat NIPT masa dia dalam kandungan 6 hingga 7 minggu sahaja. So dia dah miss period and then went to a clinic and then did scan, UPT positive. Scan nampak kantung saja. Lepas tu terus offer NIPT. Alright, so NIPT came back as normal, all low risk, tak ada issue. And then dalam lebih kurang 12 minggu hingga 13 minggu, tengok baby tak ada tempurung kepala. So it means that rugi patient bayar so much for your NIPT at 6 weeks, 7 weeks because masa tu we tak boleh tengok baby punya struktur lagi. So that's why we are trying to emphasize NIPT tu penting, but prerequisite atau prasyarat must be fulfilled. Dia bukan you buat bila you suka, the moment you pregnant dah dapat 2 line dekat urine test, you terus nak rush buat NIPT. That is not going to say that your baby is normal. Alright, so it's advisable that you get your dating right. Of course, get your pregnancies in the location in the intrauterine. Get until your first trimester screening done, which is usually done at about 11 to 13 weeks. Once that's done and we see all the structures are normal, and make sure that it's not twin, because twin NIPT akan jadi complicated. Macam Dr. Purni cakap, triplets dia akan jadi different way of interpretation. So always make sure that all this is sorted out before you embark into an NIPT test. Alright. So now, siapa yang akan berfaedah paling banyak untuk NIPT ni, doktor? Like for example, we got many scenarios now dalam dunia moden ni. We got people transferring embryo at a 48 years old, dah dekat-dekat nak menopause, ada juga transfer embryo. Ada yang now we are having masalah-masalah social, 14 tahun, 15 tahun also already getting pregnant already because of social issues. So this extreme age are giving MFM a big headache because we are dealing with high risk pregnancy in terms of maternal age and also high risk of the baby becoming abnormal. So there mesti ada which group of patients that will benefit the most from NIPT. So what do you think about it, doctor?
Okay. So if you ask me, Vignesh, setiap wanita ada hak untuk mendapatkan genetic screening. Every woman has a right for NIPT screening, you know. All right. So that we have to keep in our mind. Okay. There's no a single answer that you can say to. You cannot say no to one woman and yes to the other woman. Okay. The right has to be given to the patient to make a decision. We call it an informed decision. She has to understand, she has to faham what is it benefit her, how does it benefit her. Then she makes a informed decision whether she wants to do it or she doesn't want to do it. Okay, well, let me tell you this. Okay, so different setiap negara dia ada cara dia offer this particular NIPT screening. You know, they have their own models how they want to offer. In some countries, they offer it as a primary screening in the first trimester. Okay, patient comes in, she gets a scan done, she probably gets an NT, and then they add on with the NIPT. Okay, and then some countries they do contingent screening, means the patient comes in, they will scan, they will do blood test and everything. Then they will categorize. Dia akan bahagikan patient pada 3 kategori. Patient yang sangat low risk, patient yang sangat high risk, and intermediate risk. So yang low risk tu dia kata okay lah, you're very very low risk, tak perlu buat NIPT. Yang very high risk tu yang ini tak boleh buat screening test, tak boleh NIPT, kena buat diagnostic test, kena ambil tissue daripada baby. Yang intermediate risk ni baru dia orang bagi NIPT. Atau there's few other countries they actually offer based on the scan. So if they find any subtle features on the scan, single markers, soft markers, baru buat. Ataupun baby patients who've been affected with the previous child with Down syndrome. So different ways of offering. Of course, I cannot say one is superior to the other. All right. But what I want to tell you is, we go based on risk stratification because we do not have a proper screening proposal as of now. Okay, so which means in a very low risk woman, a very young woman, okay, when you do a scan, you don't see anything abnormal, it may not be actually necessary, but you have to speak to a woman about it and see what is her concern, you know. But on the other hand, if you see a very high risk woman, elderly group of women, or with ultrasound findings that is concerning, then this group of women, you cannot ask them to go through NICC, which is a screening test. So you are going to put them into uncertainty. So this patient, you directly want to know what is the fetal situation. So you go for a diagnostic test. So this is how we can actually try to, you know,
try to get people to come and do it. And this is probably an umbrella for us to get people to come and do the test actually. Yeah, but the only issue is with NIPT is our KKM doesn't have it, so patient have to pay on their own. So issues with financial is also one of our major challenges when we come offering genetic testing to
Yeah,
patients. Yeah, so
definitely,
although we can
definitely.
easily say that we can give offer everybody, but not everybody can actually afford it. But the key point here is if they fall in this high risk group, which may cause their baby to have high risk of getting genetic problem. So this will require proper counselling, because when the counselling is proper, they will also maksudnya dia akan consider, okay, I should do, maybe I can ask money from some other people or some bantuan and all that, because we know this group of people are at high risk. Tapi patient-patient yang low risk yang cannot afford, then maybe it just maybe they
Alright.
won't be able to
So
do
let
it.
me give
Yeah.
you this situation. You
Hmm.
probably have kalau you contoh lah, you tengok patient 45 tahun dekat buat IVF, 45 years old, and she got
Hmm.
pregnant after 10 years.
Uh,
She's very concerned, very anxious mother. And then you do a scan, and you see increased knuckle translucency, and you
hmm.
go and offer her NICC, and NICC comes back as low risk.
Hmm.
So, are you happy to tell her, look, the baby is well genetically, correct or not? You won't, you
Hmm.
won't, you won't be able
We
to
won't.
do
Yeah.
that, right?
Correct. Cannot.
Correct. So, because you have a mother who's 44-year-old, and then knuckle translucency is abnormal,
We can.
but
Hmm.
you only have a screening test. You
Tak
understand what I'm
boleh.
going to say now? You understand what I'm
Yes.
trying to say? So, this
Yeah.
selection, uh,
Hmm. Patient
your
selections are
patient
very
selection,
important.
risk
Hmm.
stratification, yeah.
So doctor, now buat terlampau awal pun we are not happy, we get very angry. Buat terlampau lambat pun we get very angry. So when do you want to tell them, okay, do too early, maybe we cannot get enough fetal sampling, or we haven't done the first trimester scan, MFM marah. Then what too late, MFM marah because too late for termination of pregnancy already. So in your opinion, the best time to do NIPT, bila doctor?
Okay. So practically, when bila kita buat NIPT, Vignesh, we are looking at cell-free DNA. Am I right? I told you, these are the DNA yang tidak bersangkut dengan, I mean, it's free floating dalam plasma kita. Okay. And this cell-free DNA ni kita datang ada yang daripada ibu and ada yang daripada placenta. So kita yang nak daripada placenta because we are looking at the placenta speaking for the child, okay? And the concentration of the placenta origin punya cell-free DNA, it ranges from 2 to 20%. As the gestation advances, the concentration increases, okay? So we want a good fetal fraction. An acceptable fetal fraction is for interpretation should be more than 4% fetal fraction. And that is usually obtainable after 10 weeks, you know. So after 10 weeks, if you call the patient around 11 to 12 weeks, 11 to 13 weeks, you do your first trimester scan, you look at the viability, you look at the number of gestation, you look at the growth of the fetus. If you can do NT, you perform an NT. If you can look at the structure, you look at the structure, then I think it would be best to talk to the patient about the NIPT.
Yeah, so that will be the best time to do. And also why kenapa kita tak nak buat lambat sangat? Contohnya lah kalau you buat NIPT keluar high risk. You buat NIPT ni 20 minggu. And the result takes about 2 to 3 weeks for the results to come back. Okay, so you buat NIPT 20 minggu, by the time the results come back 23-24 minggu and katakan high risk. And then at that time it will be very difficult for us because we are in the grey area of considering diagnostic tests, and later on further if required termination of pregnancy, it will be very tricky. So which is why the best time is to do about 10 to 13 weeks, so that by the time the result tu keluar dalam 15-16 minggu, if at all we need diagnostic test, so amniocentesis can be done at that time, and amnio will take another 2 weeks for the result. So lebih kurang dalam 17-18 minggu we can decide what's best for your pregnancy. Betul tak doctor? Can I say like that?
Yeah, but sometimes I think in situations where patient uh, come to you late, in
Hmm.
unavoidable situations, where you have no choice, you have not seen them early in the pregnancy, then
Hmm.
probably this is where you have to relook at your assessment. Again,
Hmm.
look back at the patient's risk factor. What is the age? What is the background obstetric profile? what is running in the family history? Is there anything concern or not? Okay. And then you do a scan. Okay.
Mm,
So based on all that, you decide whether she needs or not. The first thing
mm,
of all, this at this point of time, this genetic screening, and if she, this genetic this genetic thing, and if she needs it, what needs it? What she needs? Is she needs a screening test or she needs a diagnostic test?
mm,
And before you decide whether you want to do a screening test and diagnostic test, you have to put to the patient what are the possibilities of the outcome and how are we going to react to the outcome. Okay, most of the time we screen to treat at this point of time, in the later
mm.
gestation means we
Correct.
screen, we diagnose. Okay, to prepare the patient for the birth of that child, so patient is aware
Mm,
what is problem with the child, what I should anticipate when the child is born. She
mm,
can explore her support group, be it family, be it in the webs, in the internet or NGOs, and she can prepare herself for the birth of the child rather than anything else. Yeah.
okay. Doctor, I just give you one scenario that happened about 1 month ago in my clinic. All right. So this couple came to me in the clinic. Dia cakap dia buat NIPT dekat private clinic, and then she's high risk of having Jacob syndrome. Okay. So and then the couple was very anxious, very gelisah, sangat stressed, don't know what's going to happen to the baby and all that, and they were at the verge of not wanting the baby because NIPT says that high risk of Jacobs. All right. So after counseling, and then we said, this is the screening test. We need to do a diagnostic test. We did an amnio. We tapped her, and the results came back absolutely normal. So, what do you think of the interpreting the results in NIPT? Like, how should we go about interpreting the results of low risk and high risk?
Okay. So again, what I want to emphasize here, NIPT is a screening test. It's not a diagnostic test. Okay.
Hmm.
Saringan, bukan diagnosis. Okay. All right. uh, how do I tell it to lamely? For example, kalau you sakit perut kan, you pergi jumpa doktor. Lepas tu doktor kata, ni takut ada benda dalam perut lah, kita buat scope. Kita buat scope, nampak ada mass. Okay. So doktor tak akan cakap kat you, ini kanser tak? Dia kata tak, ni saringan ni kita dah buat, nampak mungkin macam kanser. Tapi apa yang akan cakap ni kanser ke tidak, ada tisu biopsi kan? Doktor akan ambil tisu biopsi, baru okay, confirm benda ni kanser ke tidak. Sama juga. So saringan tak boleh nak cakap benda baby tu confirm ada problem, tak ada. Saringan tetap saringan. Tak kisahlah 99 sensitivity ke apa, saringan tetap saringan. Okay. So katalah NIPT you keluar dua benda je. Satu low risk, satu high risk. Katalah NIPT you keluar low risk, baguslah, happy. Means chances of you having a normal child is very, very high. Chances of you having an abnormal child is very, very low in terms of the 5 chromosomes that I've stated to you. Correct or not? But no, having a low risk NIPT does not tell you that the child will be completely normal in terms of intellectual impairment, development. It doesn't tell you the child will not have other problems in terms of structures. Means NIPT low risk, akan ada masalah lain. Tak semestinya. Masalah jantung, masalah tulang belakang, masalah air dekat kepala meningkat, tu semua benda lain. It's structural problem, not related to your NIPT. So the routine antenatal care has to go on. The structural survey, the growth scan has to go on as usual. Okay. But on the other hand, if you have a high risk testing, then what I tell you is there is high probability of the child to have a problem. I cannot tell you the child has a problem. Correct or
Correct.
not? Okay.
Yes. High
And
chance
there
that they may
are
have.
situations. Yeah. Okay. And there are situations. I told you the false positive is low. I didn't tell you the false positive is zero. There are still chances that you might have a false positive. In what situation you can get a false positive? For example, a confined placental mosaicism. Means the genetic of the placenta does not match the genetic component of the fetus. You have to understand, I told you that the cell-free DNA comes from the placenta. And most of the time, they both match. We assume that it comes from the fetus. So if you have a confined placental mosaicism, that you can get false positive. Sometimes
Mm.
maternal aneuploidy, maternal mosaicism, maternal copy number variant abnormality also can give rise to this. So we have to confirm the diagnosis. So confirm the diagnosis two ways by
Mm.
taking the biopsy. Okay. So most of us prefer to take a direct biopsy of the child, which is through the amniocentesis. Means it's actually we call it a needling technique. We consider it is invasive, is relatively safe, done by somebody who is experienced to do it. You put in a needle into the womb, okay, under direct ultrasound observation in a plane which is free from placenta and vessels, and then we will aspirate the fluid and we will send for genetic testing. Okay. On the other hand, there's some who actually go for a CVS, which direct sampling of the placenta. But of course, we have to be careful interpreting it in terms of the confined placental mosaicism. But what is
Doctor,
most importantly, I need to tell you this is no pregnancy should be discontinued, okay, or for an abnormal screening test. That something that I need to put forward in. Okay.
yeah, so this is the key point. NIPT is a screening test. No action should be taken to the pregnancy until it's confirmed. All right, and how to confirm? You need to do a diagnostic test. And diagnostic test, we got two diagnostic tests, which is amniocentesis or chorionic villus sampling. All right, Doctor, pernah tak you experience they ambil NIPT, but tak boleh nak interpret the results? Doctor, have you come across a
Sorry.
situation where
Okay.
you do an NIPT, but the results came back as not low risk, not high risk, tak ada result, cannot interpret.
So we call it no call, uninterpretable. All right.
Okay.
So there's a few situation that this can happen. It can happen a few situation. One, what can contribute? Contoh cara pengambilan darah tak betul, can inappropriate collection of blood can actually do it. Sometimes when the fetal fraction cell free DNA yang daripada placenta tu tak cukup untuk interpretation, less than 4%.
Hmm. Maksudnya
So
ambil
that also
terlampau
you
awal
can
lah.
have. Sometimes mothers who are, yeah, kira terlampau awal. In some
Hmm.
women, they have a low fetal fraction also for certain reason. For example, if the woman is big, so they have a lot of adipose tissue turnover. So the maternal DNA actually predominates the fetal DNA. So you will have relative reduction in the fetal fraction. Also can happen. Some maternal autoimmune disorders, SLE, also contribute to this. Some medication, a lot of patients are on low molecular weight heparin, so that also can contribute to this. Acid failure is another thing. So when you have a low, no call or uninterpretable result, you kena tengok balik tempat mana yang tak betul. You have to go through it back and you try to correct it back. Look at your cara pengambilan darah. Okay, look at the fetal fraction. Okay, look at the maternal medication. Can you alter or not? Okay, then you look back at the overall patient profile, which means do you have to have a time to actually go through another screening test, which will take another 2 weeks, or the mother probably need more diagnostic testing, which you can shift to amniocentesis or something like that.
Okay, great. So, doctor, I think this discussion and about this chromosome testing and genetic testing and all that, it's actually very heavy and quite complicated. All right. So we have spoken for about 30 minutes, and can you summarize the key points or the take-home message that we should tell the audiences regarding NIPT? Just the key points, Doctor. Update, chuck, key points.
Okay, can. So let me tell you this, NIPT is a very good tool. Okay, but it is not the ultimate tool. Okay, it doesn't guarantees you a healthy child. Okay, it is a very good screening test. Screening test, especially for the 5 chromosome, with a very good detection rate, very high specificity, and very low false positivity rates. Okay, before whether you are a obstetrician or you're a patient, before anda menerima atau membagi suggestion untuk berbuat NIPT ni, two things you must do, the pre-execute. One, go through a good history and go do a good ultrasound. And as a patient, sebagai pesakit, anda kena faham apa sebenarnya NIPT ni dan bagaimana dia boleh membantu kandungan anda memahami kandungan anda. Itu kena they must be prepared for the upcoming result of the test. Okay. And remember that NIPT does not exclude all the genetics. So people might think my NIPT is no risk, so my baby doesn't have any genetic problem. That's not right. NIPT doesn't guarantee a other intellectual disability. So it doesn't tell you that the baby will not have any intellectual disabilities. Many other reasons for intellectual abilities. Autism cannot be excluded. And although you have a low risk NIPT, you still have to go for routine antenatal care. Details send will let you know about the structure of the child. Growth will let you know about the growth of the child. Okay, and above all, if you have a high risk screening, it is just a screening. It tells you the high probability of the child having the disease, but it doesn't confirms it. So no pregnancy should be terminated just based on a positive screening test.
Okay, great, great. So selepas ni kita tak nak patient datang kat kita cakap, NIPT saya normal, kenapa baby saya keluar tak normal? No, that shouldn't be an issue because we have already clearly explained to you all what is NIPT. It's only a screening tool. So coming back to our topic, apakah itu NIPT? I think we already answered through our whole conversation. And adakah NIPT menjamin bayi yang normal? Jawapan dia,
Tidak.
okay, jawapan dia tidak. Yes. NIPT tidak menjamin bayi yang normal. Alright. So this is the end of our conversation for NIPT. Please like our page to follow more videos about interesting topics in obstetrics and gynecology. So stay tuned and we'll hope to see you all back again in our next topic. Okay, thank you, Dr. Bonis, for all your
Okay.
input. It's been
Thank you.
really great to have you.
Thank you very much, Vignesh.
All right. Bye.
Okay. All right. Thank you.